Welcome to The Exam Room, the podcast where we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. I'm your host, Rhiannon Windsor, and we're charting a course through patient engagement. Let's grab in and get started. We're continuing our conversation with Sonia about engaging Medicare beneficiaries, and what I'd like to talk about next is best practices. What best practices have you developed over time for engaging with patients?
When making the outreach to these patients, the beforehand research is important, and then getting into these conversations to learn as much about the patient as possible before getting into the health profile of the patients. Learning about what that patient feels is important is your best tool when you're building the relationship with them. Mm-hmm. That way you can start building on what you can relate to, or if you don't relate to it at all. A lot of times just asking them to describe it to you, tell you how it feels, tell you about how that works or what that experience is like, builds the relationship. Mm-hmm. So if you don't know or you're not familiar with something that they're going through, letting them explain it to you builds their confidence in you for some reason. They really feel like you're listening and you really want to know about what they're talking about. And that gives them a wide opening to tell you a whole lot of things that you weren't expecting before. And I think that's important.
Yeah, I think that is a powerful weapon, like feeling like somebody's out there who cares.
I haven't experienced everything out there, and I haven't had family members that I've witnessed firsthand who have experienced certain things either. So there's a lot of times I don't know what it's like. So they have to tell me what it's like so that I can get a good picture of it. And when you tell somebody, can you tell me what that's like? For a lot of them, it's the first time anybody's ever asked them what their view of it is like. Because everybody has their already, built up opinions. I don't have an opinion on it. So tell me what it's like. And they're happy to do so. And then they really start to feel comfortable with you.
Yeah, so that's a good point that you bring up about not having an opinion. Yeah. Like
I'm neutral.
You're neutral. You're discovering about them. You're not there to share yourself as much as you are to get them to share a part of themselves and connect.
And sometimes I do have to share personal experiences with things, which is fine. I'm an open book. I don't mind. My real goal at the end of the conversation is to make them my new BFF and for them to feel like I'm their new BFF. And maybe it takes one call, maybe it takes two, it could take three. But they need to know that they have a friend on the other end of the line, not just a healthcare provider who's trying to schedule an appointment or get them in for an annual wellness visit or, follow up on a medical bill. I'm actually here as a friend, and that's important to them.
Yeah. So that makes me think of a couple things. One, you said you're an open book. Yes. What if somebody isn't? Somebody that's outreaching does not have that same willingness to share and be open. What advice would you give?
Okay, so if they're not an open book and they're not willing to share, first and foremost, I would say don't lie. Don't make it up. That will come back to haunt you later. If you're not comfortable sharing personal experiences or experiences that you've witnessed firsthand, I would say this job is going to be very difficult for you. I would say it's hard to relate and to get into somebody else's shoes if you have no context to base it from. So maybe that's not the person to do the outreach. Maybe that's more the person to do the background stuff, doing the research, finding the resources. Not saying they can't be part of the team, but maybe that's not the person who's forefront and putting their personality through the phone, because it may not resonate well with the beneficiaries if they can't relate.
I think that's a good takeaway for leadership as they're kind of guiding or choosing who's going to be doing this outreach for them.
Yeah, putting the right person in that spot is important, I think. They need to be able to have these conversations, these real conversations with these people. Not scripted, not check boxes to check off, but real conversations.
Right. The other thing that when you were talking, it made me think about patience.
Oh, yeah.
Not like the people patience,
Yeah.
but like having patience,
Yes.
being patient enough to let the relationship and the conversation evolve.
Yes, and that conversation can be lengthy. You may ask a question about when was the last time they saw their primary care physician, and you may get a 45-minute answer. They'll get to it, or they'll ask you to ask a question again because they forgot it. But it's important that they get the chance to tell you that 45-minute explanation because there's a story there. They're going to tell you about it and the reason why they haven't seen their primary care physician in a while. And that's important.
Yes, definitely. Those are all such great tips. Is there any other thoughts that you have about the importance of following up and what that approach should look like?
First and foremost, you need to let them know that it wasn't a hassle to do what it was that you said you were going to do. You were happy to do it. It's not a chore. It's not a job per se, but it was important to them, so therefore it's important to you. Then, by following up, even if you don't have the answer yet, you still follow up and let them know that they're still in your mind, you're still following through, it's just taking you a little longer, and they're always very understanding. Don't drop the ball. As soon as you drop the ball and you don't follow up, you discredit yourself as being a resource to them. And it's important that they know that they can rely on you to assist. Doesn't mean that you're always going to have every answer or that you're going to have every resource that they need, but it's important that you do follow through with what you say you're going to do. If there's something that you know you're not capable of doing, you need to tell them that. But tell them that up front. Don't make them wait to find out. Know what your limitations are.
Right. It makes me think of my dad. He's retired. He's on Medicare and he had to have a tooth pulled. And so he's limited in his funds and he's worrying, is insurance going to pay for this? And so he called the office several times. The office was not helpful. It was so like, oh, well, okay, I'll get to that, but then not getting back to him. And so this whole time, maybe 2 months, he's waiting to have his procedure. And anytime I talk to him, he's like, well, hopefully insurance will pay for it. Like most of these beneficiaries are retired and they're taking their Social Security or whatever, and they don't have a lot of extra money at the end of the month.
Yeah, and a lot of them don't know what's covered and what isn't. And have you looked at the information that's sent out? It's
so
a
confusing
lot.
too.
And it's confusing. So as a outreach person, you got to kind of know this stuff or know how to look it up so you can answer some of these questions. Never tell them you know if you don't. Just tell them that you'll find out and get back to them with the answer. If you find that something's not covered, see if there's other programs out there that would cover it. A lot of times you find, for your example, sliding scale dentists who, if you have a patient who's on Medicare or Medicaid, they could be on a sliding scale based off of their income. And so, services, dental services, eye services might be a lot cheaper because a lot of the, programs and plans do not cover that stuff. And it is out of pocket. And nobody has that money just sitting around waiting for a tooth to need assistance.
The lady at the office kept telling my dad, well, if insurance doesn't cover it all, we'll invoice you.
Yeah.
Like, that doesn't make me feel like you're caring about me and like my care, and this out-of-pocket cost has got me feeling anxious and worried.
Yeah, my own mother goes through that regularly, and her big thing is she wants to know that If her premiums are taken out of her account immediately, she never even saw the money, she's more comfortable with that than getting surprise bills from the doctors or the dentist, right? Sure. So she wants to make certain that her plan and then supplements cover as much as possible up front, so those surprise bills don't come in the mail. Nothing is more stressful than our elderly patients getting these surprise bills in the mail. And now they have to think about how they're going to pay that. And in their mindset, they really want to kind of pay it all at once. They don't think about the pay over time method. It's so stressful for them to think about where's that money going to come from when they don't have it. You need to build up that toolbox of programs and services that are available to your Medicare beneficiaries so that you have it at your fingertips when they need it. You can keep adding to it as you go. Having a team together doing that research in the background is great. That's key to making it successful.
So that was kind of my next question, was about teams and how can care teams align to ensure consistency in the outreach. Any other thoughts about that?
Making sure everybody has the same purpose, and that being to help the beneficiary. It could look different for every single beneficiary, but the ultimate goal is to help the beneficiary in whatever it is that they need. So your team, when you're putting together your team, you'll have people who are very much capable of doing the outreach part and maybe a little less capable of doing the background checking, the research, etc. They feel comfortable talking to the beneficiary, but maybe they don't know where to start when it comes to looking for programs and such. And then you have other people who really don't feel comfortable talking to the beneficiary, but they can really offer their services by doing the research and finding programs. All of those staff or teams are important in order to bring it all together. Most importantly, though, they all need to be on the same team, and that is to help the beneficiary in whatever it is that they need help with, and doing the best that we can to do that. Everybody needs to hear what the beneficiary is saying, whether that's, if you're powwowing and meeting every week about the beneficiaries that you have lined up and what it is their needs are. Everybody needs to understand what those needs are and what's important to the beneficiary, not just what we might think is important to them as an individual, but then brainstorming and deciding what's going to best to suit that beneficiary and what it is that they want to do. Because again, it's never about us what we want them to do. It's always about what the beneficiary wants to do. Mm-hmm. We never force them to do something specifically. It's always going to be driven by the beneficiary. And giving them that control also makes them feel a little more comfortable talking with you. Building up your team is very important with the right people in place.
Yeah, and communicating with them. It sounds like. Mm-hmm. Would you suggest that teams are meeting on a weekly basis, or what might that look like?
Weekly, daily, whatever works best for them. But depending on your beneficiary list, you might have to do it more frequently because it would be a really long meeting if you had a lot of people on that list on a weekly basis. Yeah. So daily, it might be even more beneficial for them, just so everyone's always on the same level, the same path. They can brainstorm together on what's the best way to approach this situation versus this situation.
It makes me think of that 20/80 concept, like 20% of the iceberg is kind of peeking out of the water and 80%, so yes. That outreach person is kind of like that point of contact.
Yes.
And then the team is kind of underneath supporting that outreach effort.
Absolutely. Not just one person can do it, that's for sure.
Thank you for joining us in The Exam Room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation on patient engagement was as insightful as your last checkup. A big thank you to our guest speaker, Sonia Sonato, for sharing her expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. I'm your host, Rhiannon Windsor. Until next time, take care, and thanks for listening to The Exam Room.